episode number 5, we were talking about stress and back pain. In the next 10 minutes, I'll discuss what, why, and how stress can cause back pain. And let me tell you right off the bat, it's not because you're broken, it's not because you're just getting old, and it's definitely not because you slipped a disc. And that's good news. But then what the heck, because my back is tight and it kind of hurts, and I haven't really done anything, please make it stop. Well, 10 minutes from now, you'll have a more clear picture of why you have back pain, how it can hurt during a crisis and a stressful season, and then what you can do about it. So let's talk about what. What causes back pain? Well, we used to think, and still it's very common belief, that back pain is caused strictly by damaged tissue or pathology. And if you have pain, you definitely have damaged tissue or wear and tear or a slipped disc or a pinched nerve. We've all heard this. We've also heard that in order to fix that damaged tissue, you need an intervention, and you definitely need to stop doing that thing that caused the wear and tear or that caused the damage now and forever. Before I go on, please hear me. This is not the case. Or let me be a little bit more politically correct. More times than not, this is not the case. Back pain is a little bit more complex than this linear approach in that, 1, I damage the tissue, 2, I get intervention, surgery, injections, treatment, drugs, MRI, x-rays. 3, I rest that tissue as it heals. And then 4, I'm good. Back pain goes away. Life's back to normal. Everything's fine. Wrong. Many of you right now have some type of back pain and nothing really happened. How many of you have had back pain years ago, have had treatment, and it's still kind of there? This is common. We know 80% of the population will experience back pain at some point in their lives, but 80% of the population doesn't need an MRI or surgery or pain meds, and frankly need to see a therapist, any type of therapist, 3 times a week for the rest of their lives, but I digress there. For the context of this video, having back pain in a crisis, meaning you may not have fallen or you didn't get tackled or bend over or twisted from your knees, or you may have had an injury years ago and ever since that time you've had an issue, or you were fine and haven't had any issues. And over the past few weeks, you've actually taken it easy. You've actually had less work. You haven't had time to work out. And for no reason whatsoever, you woke up with back pain or your back's really sore by the end of the day. So yeah, back pain is a little bit more complex than just a little sprain in a tissue. You have to look about the whole person, and each person is different. Overcoming pain truly is a multifactorial approach. The bad news is that means there's not one pill you can take and everything goes away. There's actually not one perfect exercise that fixes everything. But the good news is that a lot of drivers for pain fall into one of my favorite categories, things we can control. So rather than looking at the old, very linear approach to pain, let's talk about the multifactorial lens of stress on a system and how stress can lead to pain. We know we have stress on certain structures. We also have stress on our psychology and stress from different types of social interactions, or right now, lack thereof. Now, I'm not going to throw the baby out with the bathwater. We do know that certain structures in your back can be drivers of a person's pain experience. We know a really good clinician can identify a structural pain driver without the use of x-rays or MRIs, and then they can determine an appropriate path of care. We also know big scary words like disc herniations, SI sprains, degenerative disc disease, wear and tear, and arthritis may not be as big and scary as we once thought, and may even play a much smaller role in driving a pain experience than we used to think. And if they are, we know that more options other than surgery or injections can allow clients to overcome their pain, long term and short term. So assuming we didn't get tackled again or fell and nothing is broken, what are the other factors? One of the biggest we are facing right now is a social component to back pain. We see this daily in our clinics, and research continues to support this. We know that social aspects of our life absolutely can lead to back pain. And here are a few examples. Work. It's an important part of our life. It can support my family. I can contribute. I can serve. I can fulfill my gifts. I have a purpose. I have financial security. I have a sense of identity. And for a lot of us, work has been taken away. And for most of us, it has been disrupted. We know this can cause stress, and that stress can increase back pain. Home life. Difficulties with the new dynamics we're dealing with right now. We have more kids at home. Your new coworker that is also your spouse may not be able to take and give constructive feedback as gracefully as your old ones. These difficulties can lead to stress and pain. Has your home life been disrupted? Yeah. And on the other side, a healthy home life is actually a huge factor in overcoming pain. Social support. How many of you guys feel better when you go to the gym? When you see your friends? When you do something with a team? When you push it knowing your coach and your crew has your back? I do. And we had that taken away from us. We lack that. That causes stress, and this can cause back pain. So beyond the biology and the anatomical stress, beyond the social aspects of stress, we also know there are psychological components of back pain. If we have fear or uncertainty around our pain, if we tend to think about worst case scenarios in regarding our low back, if we don't acknowledge the pain, if we don't have the skills or put in the work to overcome the pain, if we're a little depressed about it. You ask the question, what are we even talking about in regards to pain right now? But we know these things can lead to increased pain and increased symptoms. Throw all of this on knowing that sleep deprivation increases pain by 25%, poor diet, nutrition, increased alcohol consumption can all lead to stress onto your system. Is it becoming more clear why you can have back pain during a time in your life right now? But why and how? Really, it's all about the brain. At some point, we have had an injury or acute stress, and that injury tells my brain that there is pain. Pain in this sense is actually a good thing. It's a warning. It's get away from it. It's change something. But if we aren't able to overcome that signal of pain in a really healthy way, that pain can persist. And even if the tissues heal, the pain can actually continue to hang around. And what the research is telling us is that the pain signal hangs around in the brain. You keep protecting, avoiding, working around the pain sensation, again, even if the tissues are fine. How many of you have had an X-ray or an MRI and everything is normal? That's a good thing. Or even your range of motion and strength are there, but you don't feel 100%. Well, that pain signal is what's persisting. And as it persists, the brain starts to store that signal in different areas. These new parts of the brain are the same areas that deal with stress and your beliefs and connection, interactions, mood, outlook, your routine. So when those things are disrupted and sensitized and get hit hard with stress or maybe a coronavirus, pain can start to show up. We can talk about habits and patterns we fall into physically or tissue capacity and movement capacity. But as you can see, this goes beyond physical exercise. At this time, I want you to dive into social and physiological patterns you have. So rather than teaching you how to hinge and deadlift, squat heavy, swing a kettlebell, increase your mileage, which could and does help prevent low back pain, instead I want you to read a book on mindset, on stress, on relationships. I want you to call a family member, set up a call with your friends. I want you to write something down that you're good at and then go do it. Sit next to your spouse and just talk. No work. Then I want you to move more. If you have pain, find something, an exercise, a position, a class online that makes you feel good and go do that and keep doing that. That is your homework. And wash your hands. I hope this helps. I want you to know there are many paths to improving pain, and most of them already lie within you, within your brain, and within your body. Talk to us if you need help finding your path and how we can help you overcome your pain. Thank you so much for watching. We are here for you. We'll see you in your next video.